Hi, Dr. Garima here again, and we will continue speaking about the ethics questions and finish off that topic as long as it takes. Today, planning to solve at least 3 or 4 questions on ethics. Again, this is the book, comprehensive book that I have made, which has questions from Odell, 170 questions from Odell, Therapeutic Guidelines, Infection Control, Ethics, Consent, COVID-19 and public health dentistry questions, all around 440 SBQs with questions, answers and explanations. So we are on the ethics part of it. As I had mentioned, this is the most demanded part because you don't have any textbook for this. ADC has given few articles on it, but we have made actual questions which are similar to the ADC questions that are asked in the exam. You can get a sample copy of this book once you join Target ADC Facebook group. And once I approve your request, you can just go in the file section and download the sample copy of it. For the actual copy, just email me on adcwrittenmocktest@gmail.com. Yeah, I mentioned this description in this video link, so you can just go through that. So let's quickly go ahead and resume our questions. I think we were on question number 17 for ethics. I think I came 2 down. This is page 1920. Oh my god, where am I going? I think I have to make this big. That's more. 17, 18, 19, 20. I think that was page number 40, I guess. Yep, ethics. So this is question number 17. Great. Let's go back to it. What is the ethical obligation regarding cultural competence? Ethical obligation. Obligation means that you have to mandatorily do that thing regarding cultural competence. Offer the same care regardless of the background. That's true. Respect diversity and tailor communication accordingly. That is also true. Avoid asking about cultural beliefs. No, you can ask. You shouldn't avoid. If you're confused about something, you can ask very respectfully and politely. Only follow Western healthcare norms. No. So C and D are out. You can be confused between option A and B. Now, option A, offer the same care regardless of background, comes under the ethical principle of justice. So justice would be the right question for this, as to what does justice include, and for that option A would be correct. But when it comes to cultural competence, then the option B becomes the right answer, that is respect diversity and tailor communication accordingly. So if you feel a certain cultural thing is to be respected for certain things that other cultures don't mind, then you have to respect that thing. I don't have a particular example that I can give for because in dentistry pretty much it's all treatment based, and nothing that I've come across is culturally different, the treatment options. But maybe in the medical side of things, I think there are certain procedures, where certain cultural nationalities prefer and some don't. So it's okay, you just have to respect it and tailor your communication accordingly. Now, coming to question number 18, a patient asks not to document a medical condition. Now, suppose a patient has any particular condition that they think is something that other people would frown upon. So they don't want you to document it, but they have disclosed it to you because you are their medical practitioner and it was necessary for you to know it. So what should you do about it? Of course, you will maintain your confidentiality and not discuss with any other, but you still have to document it in your notes, because you are not the only doctor that will see that patient. Suppose, like I said, you're traveling or you went somewhere else and that patient comes back and some other doctor is going to see that patient. That other doctor should know what was discussed between you and the patient, because this is all professional, right? It's not like that the patient is, some informal member that it's just verbal with you. No, it's the patient came to your clinic to get a service. You have to take all the history, and if you know of a certain condition that the patient has, then you have to document it. So the option A, respect their request and omit it, is not correct. Option B, explain that accurate records are a legal and ethical requirement. Yes. Document it without consent. No, you have to tell them that you are documenting it and that their consent is required. Even if they choose to not give it, you still have to inform them that you are documenting it, right? Ask them to write it down instead. No. So option B, explain that accurate records are a legal and ethical requirement, and that's why you have to maintain it. It's very, very necessary. Okay. Question number 19. A child patient wants a procedure but their guardian refuses. What principle guides your response? Now this is nice because a very similar question was asked in ADC exam, that a young child aged 13 wanted a tongue piercing and the mother was against it. So what you should do about it? See, so long as the child is below the age of 14, any procedure done on the body of the child requires the parent's consent. Of course, it requires the child consent as well, but the parent's consent is equally important. Once the child crosses the age of 16 in Australia, apparently the children are responsible for their own consent. They don't need any adult to give in consent if they are mentally sound, stable, and you think they can make a decision about it. So what would you do in such a scenario? Well, patient autonomy. Patient autonomy is important only if the child has crossed the age of 16. If not, then the guardian's consent is equally important. And formal refusal. No, you cannot just refuse or say, I politely decline to comment. You can't do that. You are a healthcare practitioner and they have asked you for your opinion and you are supposed to give one. You can be politely refusing, but you cannot be like just informal refusing. You have to give your pros and cons and reasons for doing so. Paternal authority and best interest of the child. Yes. So you have to acknowledge the paternal authority, parental, and best interest of the child. So you have to explain that to the child as well, that what is in the best interest of the child, and you have to tell them that because the child is not 16 yet, and even though the patient might seem it's very cool and chill to get something done, if the parent has refused, then you have to abide by their orders. Non-maleficence only. Maleficence means harm. Non-maleficence means do no harm. Do no harm only doesn't fit in these options. So parental authority and best interest of the child is the right answer here. Now question number 20 and the last question for today, which is not a part of the ethical decision making framework. Identify the issue that is a part. Ignore emotional factors. Consider consequences and review legal and ethical guidelines. Consider consequences is very important. Review legal and ethical guidelines is also very important. Now the option B, ignore emotional factors. Is that not a part of ethical decision making process? No. You have to take the emotional factors in consideration. You cannot ignore it. See, I'll give you an example. Suppose if you get a child patient, say aged 8-year-old, and he has severe molar hypomineralization. Now, there is a treatment where you can put stainless steel crowns over them, and there is a treatment where you can extract those molars and allow the second molars to erupt in that place. Now, thousands of times I have just put stainless steel crown and the tooth has just been fine, the child has grown, and they have crossed the age of 16, 17, the tooth is in place, the roots are well developed, no sensitivity whatsoever, no caries for the progression. That is because that's a conservative way of treating, and patients are happy, parents are happy. But I also had one more patient who had the same problem, but not only the child was uncooperative, which is still okay because you can treat such children under general anesthesia, but the parents were very emotional about this condition, and the mother was very persistent that because she had a very bad experience in her own country regarding, putting crowns or something, and not only that, she felt that because her teeth were very sensitive, that even if the three-way air syringe water touches the teeth, she would jump out of the chair. There is no logic in that, but she had this strong emotional thing, and the child, I think, got that subjective fear from the parents, and even he was jumping just on putting the three-way air syringe water over the tooth. So they were very adamant that I extract all the four molars and let the second molars come in that position, because that is also a valid treatment. So in that scenario, when I'm making that decision with them and taking their consent, keeping all ethics into place, we took the decision to just extract the four permanent molars. Even though I had shown them all my cases where I had done stainless steel crowns, and even though I felt that saving the tooth would be much better because they are the permanent six, but still, you have to take the emotional factors into consideration. You should not argue or be hell bent on making the patient agree to what you think is right, because they have emotions, they have experienced something, and because there is a scientific treatment method to extract the teeth as well, if they choose to go with that because of their emotional reasons, you have to respect it, and you have to take that thing into your ethical decision making framework. So you cannot ignore those factors, is what I'm trying to say. This is a live example with me, so because I had this example in mind, I thought I'll share with you. So yeah, this is what that question means. So yes, I believe this is the end of it, and we further have many questions remaining for ethics. We will take it up tomorrow, and hopefully you like the ethics part, and leave your comments. It's always nice to read the comments, and have a good night. Bye bye.